Hi, everyone. Thank you so much for joining us today. My name is Beth Villani, and I work for Cochlear Americas. We are here today with a few guests from Penn State Hershey to talk about hearing loss and cochlear implants. So I'll pass the mic, and they can introduce themselves, and then we'll get started.
Hi, I'm Dr. Rachel Purrington. I'm one of the audiologists at Penn State Health, Hershey Medical Center. I do pretty much full service there for kiddos, adults, implants, and yeah, been there for a couple years now.
Hi, I'm Dr. Tina Elaholde. I'm another audiologist at Penn State Health. I work with Dr. Purrington at Hershey Medical Center, and then I also work at our Lime Spring Outpatient Center in Lancaster. I see adult and pediatric patients for hearing tests, hearing aids, and cochlear implants.
All right. Thank you, Tina and Rachel. Perfect. So if you are tuning in from TV, the TV network, this is a QR code to scan. You can use your phone camera and hold it up to this QR code to take a picture of it, and that'll take you to a link that will send an email to Cochlear if you would like to learn more information. So I'll pause here for a second and let anyone who's watching from their room or their home to go ahead and take a picture. Yeah. Okay. So today we're going to be talking about how hearing works, the types and degrees of hearing loss, go over some treatments for hearing loss, as well as hearing implant solutions. We'll discuss steps to better hearing, as well as outcomes and performance, tie everything up with insurance, and we'll have a question and answer session at the end as well. At Cochlear, we like to start all of our meetings and presentations with our mission. So at Cochlear, we help people hear and be heard. We empower people to connect with others. We transform the way people understand and treat hearing loss, and innovate and bring to market a range of implantable hearing solutions. As I said, my name is Beth Villani. I am your Cochlear Americas representative here in Pennsylvania. I represent, as I said, the whole state, and I am a speech pathologist by training. And my role at Cochlear focuses on pre-surgery support. So any question you might have about what is a cochlear implant, where do I go to get the testing done, I'd like to speak to someone who has an implant, these are all questions I can help you with. My role here is to be an educator and help you along this journey. And as I said, we have our lovely audiologists from Penn State Health here today as well. And they're going to share a little bit about the appointment process and how the structure works at Penn State as we get further into the presentation. So I would love to learn a little bit about you all, and I'll go through a few of these questions. And if one of them pertains to you, please feel free to raise your hand. So, how many of you are struggling with your hearing or have a loved one struggling with hearing? Okay. How many people wear hearing aids or have a loved one with hearing aids? Okay, I'm seeing some nods and some hands. Does anyone have single-sided deafness or where you've lost all hearing in one ear? Okay. And finally, how many of you have a clinic or doctor or audiologist you're currently working with? Okay, great, thank you. And although hearing loss can feel like a very isolating experience, one thing we like to remind people of is you are not alone in this process. About 1 in 3 people over the age of 65 experiences some degree of hearing loss, which is about 48 million people. So it's quite a vast number of people who are experiencing something similar. And as I said, although it can feel very isolating, you can take some comfort in knowing there are other people who have walked this path and found solutions to help. And before we get into types of hearing loss and solutions, we're going to go back to the basics and talk about how hearing works and what hearing actually is. So I'll let this video play, and then we'll move on, and I'll talk through some of it as it goes too.
How natural hearing works. The ear consists of 3 sections: the outer ear, the middle ear, and the inner ear. All 3 sections work together to deliver sound to the brain. In normal hearing, the outer ear picks up sound, which it sends in waves down the ear canal to the eardrum. These sound waves strike the eardrum and cause it to vibrate, sending the bones in the inner ear into motion. Fluid in the inner ear, or cochlea, then transfers this motion to tiny hair cells. The hair cells absorb the movement, creating electrical impulses which are sent to the brain via the hearing nerve. This translates into the sound you hear.
So in order for us to hear, all 3 of those systems have to be working together seamlessly. And when there is a problem at any step of the way, this can lead to hearing loss. One of the ways we categorize hearing loss is the degree, and this speaks to how much this is impacting you, where the hearing loss is actually occurring. So we can have a mild hearing loss, and this might be where you're able to hear most of conversation but are missing some of the sounds. With a moderate hearing loss, you can usually hear someone is speaking, but it might sound muffled, or it might be difficult to pick out what the actual words are. And as we get to a severe to profound hearing loss, most conversation is going to be missed altogether, and you might only hear loud sounds. And in this scenario, what we'll see is that the different degree of hearing loss is categorized or mapped on this picture here. This is called an audiogram, and it describes the type and severity of hearing loss that a person has. On the left side is the degrees of hearing loss. Softer sounds are at the top, and our louder sounds are down at the bottom. So a line that is lower indicates a more severe hearing loss. The yellow shape on this audiogram is commonly called the speech banana, and this is where all of our speech sounds fall. They're quite high, they're quite soft relative to some louder sounds that we might experience. So you can see the specific letters are on the audiogram itself, showing where they fall in the degrees and the level of loudness of the hearing loss. And so for a person with moderate hearing loss, we'll see that hearing, moderate to severe, that hearing loss is impacting them so much that they're not able to hear a lot of these speech sounds. And while we talk about the degrees of hearing loss, what level of loudness you're able to hear, there are also different types of hearing loss as well. So as the video described, there are 3 different parts of the auditory system that have to work in order for us to hear correctly and hear well. When one of those systems is not working, or multiple of those systems is not working, we have a type of hearing loss. One of the types of hearing loss is called sensory neural hearing loss. This is when the issue with the hearing loss is related to the cochlea, the innermost organ of our hearing system. So this is when the hair cells in this organ specifically are not working the way they're supposed to, leading to the breakdown. Common causes of this type of hearing loss are congenital hearing loss from birth, aging, exposure to loud sounds, and there are some other reasons as well. Treatment options for this can include hearing aids, cochlear implants, or hybrid solutions. And we're going to talk about all of these types of solutions as well. Single-sided deafness is when just one side, one ear, is experiencing this deafness. Common causes of this can be viral infections, Meniere's disease, head or ear injuries, and a variety of other causes. In this scenario, we see that sometimes people are candidates for solutions called bone conduction solutions, cochlear implants, or a cross hearing aid. A cross hearing aid is when the sound from the ear that is deaf is sent to the good ear. So you get the picture of sound channeled directly into your good ear or your stronger ear. A conductive hearing loss is when the system in the outer or the middle ear is the problem for the hearing loss. This can be potentially a malformation at birth if the outer ear didn't form correctly, draining ears, tumors potentially can cause this type of hearing loss. And with conductive hearing loss, Treatment options often include surgery, hearing aids, bone conduction solutions, or potentially medications as well. Finally, mixed hearing loss occurs when there is a difficulty with the hearing system in both the inner and the outer or middle part of the ear. So you have two parts of the system that are not working as intended. In this situation, treatment options can include medications, surgery, hearing aids, and bone conduction solutions as well. So we have 4 different types of hearing loss in addition to the 4 different degrees of hearing loss. When we talk about hearing loss, we also want to talk about what the solutions are. One of the most common solutions people are familiar with is a hearing aid. And I know we have some hearing aid users in the audience today and some other people watching, so most of you may be familiar with how a hearing aid works. A hearing aid is essentially an amplifier. It's taking the sound that you're hearing and turning up the volume to increase your ability to hear what's happening. So this is a potential solution for people that have mild to severe hearing loss, still have some function in their cochlea, but need that amplification, that louder sound. However, sometimes hearing aids don't do the entirety of the job that they're set out to do. So potentially in these situations, we see that people whose hearing aids are not serving them enough might have trouble in conversation, might have trouble hearing on the phone, rely on lip reading, or are finding themselves turning to a specific direction to hear from their stronger ear. And these can all be signs that potentially the hearing aid is not serving you as well as it should be. In this case, as I said, the hearing aids work as an amplification, so they're turning up the volume. But potentially, if this is someone with a profound hearing loss, let's say at the 90 decibel level, kind of near the 90 to 100, near that lawnmower, if the amplification is getting you up to 60 or 70 decibels, that's still not near the speech sounds. So you're getting amplification. You're able to hear more than you were before, but potentially it's not giving you access to the sounds and the conversation you'd like to be hearing. One of the resources Cochlear has is called the Hearing Aid Check. This is a resource developed by an independent research body not affiliated with Cochlear, but it is a way of testing your hearing aids informally to see if they're not working. You can go onto this website, cochlear.us/check, and go through the exercise and see if your hearing aids are serving the purpose they're supposed to be. Either way, if you're suspicious that they might not be helping as much as they should, this is an excellent time to think about how would I schedule an appointment? How could I meet with an audiologist to get a formal diagnostic hearing examination and make sure the hearing aids are doing the job that they're supposed to be doing? In this case, if they're not helping as much as they can be, this is potentially a time where an audiologist would consider a cochlear implant. Cochlear implants are for people with moderate to profound hearing loss, and they consist of 2 parts. There's an internal implant, which is the device on the left side, and then there is an external sound processor. This is the part we commonly see when we see someone with a cochlear implant. There's a magnet and a microphone. The magnet holds the device in place, and the microphone picks up the sound so that you can hear. Bone conduction solutions are a different type of implantable hearing device that are geared towards people with a different type of hearing loss than sensory neural. These devices work by being implanted, as I said, into the head similar to the cochlear implant, but they bypass the damaged parts of the ear and create that sound. So it's different than the cochlear implant, but it can help people who are candidates for this type of solution also. So as I said, the cochlear implant system has 2 different parts. There is on the right side, the internal implant. This is the part that is placed during surgery. And then there's the external sound processor. There are 2 options for this, both of which are pictured on the left part of the slide. And as I said before, they both have a microphone to hold this in place, and a magnet to hold it in place, there we go, and then a microphone to pick up the sound that is happening around. And this video explains how they work.
How the cochlear nucleus system works. The cochlear nucleus system replaces the parts of the inner ear that aren't working. Unlike a hearing aid which makes sounds louder, the cochlear nucleus system works to make sounds clearer, so that it's easier to understand conversations. It's comprised of two parts which work together: the cochlear implant and the sound processor. The sound processor sits outside the ear and can be worn behind the ear or off the ear. The sound processor is connected to the implant which sits under the skin. The implant is attached to an electrode that is placed by the surgeon in the cochlea. Sound is picked up by two microphones on the sound processor and sent to the implant, where it's converted into signals that are sent into the cochlea via the electrode and are interpreted by the brain as the sounds you hear.
So I like that video a lot because it's a really nice animation of how the system
cochlear
works.
nucleus.
There we go. It's a nice animation of how the system works and gives you a really good visual of how the sound is picked up and then communicated to the internal implant. As I said, there are two options for the external sound processor. The Nucleus 8 is the one on the left side of the screen, which has the magnet and the microphone as separate components, and the Canzo 3 is in the center. This is a processor that has the microphone and the magnet in one part, instead of two. This can be an advantage for some patients because potentially if they're glasses wearers or lifetime hearing aid wearers, they don't want something touching their ear, and the Canzo 3 gives you the option to have access to sound without a device directly on the ear. On the other hand, if you're familiar with the feeling of something going on the ear, the Nucleus 8 gives you that similar kind of experience without anything actually going into your ear canal. The next thing I'm going to discuss is the internal implant itself. The implant has three components. There's the magnet, which is the part that adheres to the external processor, the chip, which stores information, and the electrode array. The electrode array winds into the cochlea, as pictured on the bottom right of the screen, and goes on the inner lining of the cochlea to place that electrode close to the auditory nerve, giving you greater sound access. And when we're talking about choosing an implant, one of the factors is the reliability. Reliability is the idea that when we get this implant, it is placed surgically and it stays in place, does its job, and gives you access to hearing again. Cochlear has the highest reliability of any of the implantable hearing device companies, and each internal implant and both the external processor have strong warranties, giving you confidence the device is going to be in place and do its job. As I said, there are warranties for the external and internal devices. Externally, the warranty is 5 years, and included in that 5-year warranty is a one-time, no questions asked replacement. So if you do lose the device, you can get back to sound quickly without any additional cost. One of the other exciting features about Cochlear's internal implant is the Nexus system. This is the newest generation of hearing implant, and it allows for the implant itself to have a few really exciting features. One of which is its capacity to be upgraded. You can as features and diagnostic information becomes available, this internal component can be updated without any additional surgery at all. The other exciting feature is that it stores your map on the implant itself. Your map is essentially your hearing prescription, and storing it on the implant means that if a processor is lost or misplaced, you are back to sound quicker. There's no need to have an appointment scheduled. Cochlear can ship a device to you, you place it back on your head, and you're back to listening within 30 seconds. Smart implants also give you, as I said, access to updates and diagnostics as they become available. Historically, the only part of a cochlear implant system that was able to be updated was the external piece. However, with this update, the internal component can be updated without surgery as well, giving you access to innovation both internally and in the exterior component. So let's say you're someone with hearing loss and you're interested in learning if this is potentially right for you. What are the steps towards figuring out if I could get a cochlear implant? One of the first things that you'll do is figure out what type of hearing loss you have. And in order to do this, you'll need to schedule an appointment with a hearing implant specialist specifically. Learning the type and severity of your hearing loss is the first step towards determining what type of solution is right for you. Visiting a hearing implant specialist has a few steps to it, and I'm going to let our friends from Penn State take this away and describe their process specifically for hearing implant solution appointments.
Alrighty. So the first step in the implant process is giving our clinic a call to schedule an appointment for a cochlear implant evaluation. When you call our clinic, we'll determine if you're a new patient, if you're an established patient with us, and what you need to be scheduled for. At that point, we would do some testing to see if you're actually a candidate for a cochlear implant. And we would test for that with some hearing aids. So we like to make sure that you're tested with hearing aids that are working appropriately, and see if that is benefiting you enough. And if not, you're likely going to be a cochlear implant candidate. We would go over the results of the implant evaluation with you and then talk about the next steps. If you are an implant candidate, you might talk to one of our ear, nose, and throat, or ENT surgeons. They would make sure that you're a cochlear or a surgical candidate by doing some scans and making sure it's safe for you to go under surgery. And then you would come back to see us and select your device. Am I getting carried away with the steps? Okay, good. And then you would come back to see us and select the device. We're going to work with you to pick out a color that you like. What's really great about Cochlear Americas is they have some accessories that they come with. We would pick out accessories for you based on your needs and your lifestyle. And then you would have a surgery. The surgery is an outpatient surgery, which means you don't have to stay overnight, and it lasts about 3 to 4 hours, and you get to go home the same day. You do not get to hear when you have your surgery. So you're going to go home, you're going to wait about 2 to 4 weeks, and then you come back to see me or Rachel or one of our other cochlear implant audiologists for an activation. That's where we turn on where we connect the external processor and your implant on the inside, and that's when you get to hear with the cochlear implant for the first time. When it comes to getting a cochlear implant versus a hearing aid, there's a little bit of time that's needed to kind of refine and fine-tune your implant specifically for you. And it also can take time to adjust to a little bit of a different type of sound. And so we would work with you over time on follow-up appointments as well, so that we can assess how you're doing with your cochlear implant, and so that we can fine-tune your prescription specifically for you. Yeah.
Yep, so Tina gave us a really nice overview of the implant procedure. As she said, it's typically an outpatient procedure, so you go home the same day. We generally see that surgeons and doctors are prescribing medication like Tylenol 800 for their patients, so this isn't a procedure where we see heavy painkillers prescribed or anything like that. And this has been an established treatment option for over 40 years. So people have been getting cochlear implants for quite some time. As Tina also said, the time between surgery and activation is usually about 2 to 4 weeks. This can depend on the clinic specifically where you're having your surgery and where your activation is taking place. And getting the most from your hearing implant. Outcomes and performance are something that people love to ask questions about. What is it going to sound like? How are things going to change for me? And ultimately, this is part of the reason we have such a network of cochlear implant recipients. I myself am not a cochlear implant user, but I am more than happy to connect you to a person who is, or facilitate a conversation with someone who is a partner or a spouse of someone who has an implant as well. We do see big gains for people who are cochlear implant users in their speech understanding, quality of life, and ability to hear in noise, which are many of the common concerns of people with hearing loss or people whose hearing aids aren't serving their needs. A brief summary of some recent research, we do see that compared to 2 hearing aids, people with cochlear implants are able to hear better what's being said on television, able to understand sentences better, and are able to hear on the phone better. One of these recent studies looked at a person's ability to hear in noise with their hearing aids versus cochlear implants. This study had a relatively small group of people, about 35 to 40, but previously with their hearing aids, they were hearing about 10% of speech and noise. And following their implant surgery and rehab and recovery, this went up to 72% average. So significant improvement for this group of patients. One of the things that Tina touched on that I'm really glad she said was that this is something that takes time. So this is not a light switch solution where the second you're activated, everything's perfect. This is comparable to a knee replacement or a hip replacement. You're taking an existing system that is not working and implanting it and creating a, just completely lost my word. You're putting in an artificial solution for a natural system that is not doing its job. So someone who's having a hip replaced or a knee replaced is going to take time. You have to go to physical therapy, you have to do your exercises, you have to practice walking. Your body is learning how to use this new system, and this is very similar to the process with cochlear implants. Your body is adjusting from acoustic sound to electrical sound, and it takes time for our brains to acclimate to this. Most people say that within 3 to 6 months, things are starting to sound normal. And one of the best resources that people have is people around them to help them in this process. One of the recipients I was speaking with recently described how he was in his living room and he heard a beeping. Every few seconds, he heard beep, beep, and he looked at his wife and said, "What is that?" And she said, "That's our clock." And he turned and looked at the clock, and he said within a minute, his brain started hearing it as a ticking. So there's a lot of work and practice to hearing these familiar sounds in this different way, but our brains are really amazing organs and can adapt quickly and over time. So insurance is often a question and topic people have a lot of questions about as well. Typically, we see that cochlear implants are covered by most insurances. These are categorized differently for billing than hearing aids are, and I know most people have paid out of pocket for hearing aids or had to go through steps and hoops to get hearing aids. While there is a process to obtaining a cochlear implant, because it is an implantable device, it's a different category of medical device, and coverage often is very different for that of a cochlear implant versus a hearing aid. Again, typically these are fully covered, and your audiologist and your team can work with you to help you understand this coverage. This is also something where your cochlear representative can help you understand the insurance process, give you codes so you can talk to your insurance company and find out what your coverage actually looks like. But typically we see most people pay their deductible or their copay as a part to paying for the entire procedure out of pocket. We do have resources available to you. Many of these are out on the table out front of the chapel, but there is a website as well. On Cochlear's homepage, you can fill out this form, and resources will be sent to you for you to look through and read through. And my information is up here as well. This is the QR code that was shown at the beginning of the presentation, so if you weren't able to take a picture of it, this is another opportunity. But my cell phone number is also up there, as well as my email address and my booking link. That link allows you to schedule time for a one-on-one conversation, and those are all ways to get in touch with me. I'll give this a second as well. And last but not least, we have the information for the different Penn State locations. I believe the Lancaster one is probably closest to where we are now, but there are other locations as well if you're more familiar with one of these or established at one of the other locations. But the phone number at the bottom is the phone number to schedule an appointment with the team from Penn State. So I'll leave this up for a second also. I can also be sure to give the information to some of the staff here at Landis Homes. If anyone missed this and would like the information, we'll make sure that they have access to it for you all too. Okay. So question and answer. I would love to hear if anyone has any questions or if there's anything I didn't cover that you've been wanting to learn about. And I'll just end with one of the most common things we hear people say is, I wish I had done this sooner. I can't believe I waited. I wish I had gone through with it. I wish I'd taken the leap. Okay. Any questions?
Is there an age limit? I'm just gonna put this. What about an age limit?
An age limit was the question. Yeah, absolutely. I think that is a question that you can talk to your surgeon about if there are any specific medical complications, but we've had people in their mid to late 80s get implanted, and correct me if I'm wrong, maybe nine, okay, I'm getting higher. 95? 95. So we've also implanted people who are in their hundreds, I'm getting as well. Yes? How big of an incision does it make? The incision is about 1 to 2 inches long, so it's quite small, and then it's about an inch above and an inch behind your head. Yep, couple inches. And that's like a hole in the head? It's not a hole, no. So it's something that is put just under your skin, and I'll hold this up to, if we could get maybe a close-up of this, but it is not brain surgery, it's just below the skin. And it's something that you will be able to feel if you're running your hand across your head, but it's not going to be a big bump popping out or something that's going to need to go deep into the bone.
Is this unit waterproof?
Is the unit waterproof? Both of the external pieces are waterproof rated for an hour at 3 feet. If you're out in the rain or you have it on in the shower and you forget, it's not going to be a problem. But if you're someone who likes to swim, that's one of the accessory options you have, is getting an aqua kit to protect it from things like chlorine and salt water and sand. Yep. Thanks, Tina. This is like the waterproof. So those are the waterproof options that they have. It's a case that protects the processor. Yes. And with Cochlear, you get 3 accessories for free, so that could be one of your free options, is the waterproof case. Mm-hmm. Any other questions? Please.
Who is the doctor that performs this?
So we have 2 surgeons on staff. That's Dr. Mark Whitaker and Dr. Varun Patel. So they do them at the Hershey Medical Center. And they're usually pretty quick to schedule with. It's not like 6 months. It's usually a few weeks to, a couple of months to schedule.
So there's different people that do it at Hershey and different people that do it at Lancaster?
Oh, right. So as far as the surgeon goes, you're going to be able to talk with the surgeon at the Hershey, the main campus. Where you might be activated at for the implant is, and the processor is going to be at one of those other locations or potentially at Hershey as well. It just kind of depends. Yeah, I don't know much about.
Sure. So the question was, does the battery need to be replaced every so often? Both of the options, yeah, that's a great question. Both of the options for the processor come with rechargeable batteries. And we see that the batteries usually last about 3 to 5 years before they start showing their age.
But you can replace it on the outside?
Yes, you can. The question was, can you replace the battery? Yes, you can. On the outside. Yep, with no surgery. No, once the implant is in, it is in and it's not being touched. So no surgery, no.
How effective is this on compensation? In other words, I can hear people talking, but I don't understand what they're saying.
How effective is this for conversation? So I'll go back to the slide that talked about the ability to hear a noise. We saw that in this study, which was done with a group of about 35 to 40 people, their ability to hear in noise went up to 72%. We also see, again, 7 times the ability to hear in conversation. Great questions, thank you.
I was advised by my ear doctor not to take this process. I don't know
Okay.
why.
So,
If he had a bullhorn up to my ear, I still wouldn't understand what he said. So I don't know my problems developed after I had heart surgery. I had no loud noises or anything else. I had an office job. So, my problem started.
do you mind if I pass you this? Is that all right?
My problem started after heart surgery. I don't know if that helps anybody.
So we are not physicians, but those are great questions for your surgeon to ask. Because, and one of the great things about cochlear implants is people do not receive them unless there is an audiological need and surgically cleared.
Well, I was told I have membrane damage. Is that those little hairs that you're talking about?
The membrane is going to refer to the eardrum, but the little hairs are deeper into the ear.
Yes.
That's it. They have to evaluate you first.
They have to evaluate it. Okay.
Yep, so your
They can do that
audiologist.
in Lancaster or Hershey?
You can do it in Lancaster.
Yeah, we can. Yep, we can do it at Lancaster and the Lime Spring Outpatient Center.
Over
That'll
on
be
Oak Drive, huh?
yes. Yep, that's the closest location to here, and we do have appointments pretty readily available over there. And so the first step would just be, really to talk, and you can again proceed with the evaluation. And if you are a candidate on the audiological side, that's when we can schedule with one of the surgeons at Hershey for that. And then they can see what's going on the medical side. Yeah. Oh, sure. Sorry.
We do have an ear, nose, and throat doctor that does work at our Lancaster location. So you would still need to get the surgery in Hershey, but you could have your surgical consult in Lancaster as well. Correct. Yeah, surgery is in Hershey.
Do you mind passing the microphone down?
Is there only one company making implants?
I'm sorry, go ahead.
Is there only one company that makes these implants, or is it something that's done by only one company? Or?
The question was, are there multiple companies that make implants? Yes, there are, but as a Cochlear America's representative, this is what I can speak to most, yeah. Any other questions?
I run out of them.
Okay. Well, we will be out the back, in the back for coffee and some snacks. If you all have any questions or would like to chat with us further, we would love to hear from you. Thank you for your time.